What is cholesterol?
Cholesterol is a kind of fat that's made by every cell in our body, and that without that substance our cells wouldn't work. But when we have too much of it, it can make us sick. It can cause things like heart disease and strokes.
Is there more than one type of cholesterol?
There are several types of cholesterol. There's it travels in our blood in packets that are separated by density, so it's called high density lipoprotein cholesterol, or HDL. H is for happy, and low density lipoprotein cholesterol. L is for lousy. The higher our HDL, or good cholesterol, the lower our risk of heart disease. The higher our LDL, the higher our risk of heart disease.
If the body makes it, there's probably some purpose for all these things. What is the purpose of cholesterol in the first place?
Cholesterol helps the cell membranes structure and function, so it's important to have it in every cell. It also is the basis for many hormones like testosterone and estrogen, which give us our sexual characteristics, and hormones in our adrenal gland like cortisol, which you might have heard of, an important hormone.
So we do need it to make other things from it.
It's very important that we have the right amount of cholesterol, not too little and not too much.
You seem to hear a lot about old people worried about their cholesterol, but we're in pediatrics. Should we worry about cholesterol even in little kids?
Even in little kids, but particularly those little kids who have parents or grandparents who've had a heart attack or a stroke before the age of 60. Those are the high-risk children, and the children who have that kind of family history should have a cholesterol test sometime after the age of 2 and before the age of 5.
If the cholesterol is high, what would that figure mean?
A high cholesterol in a young child with a positive family history of early heart disease
Well, first of all,
means that
what figure would you consider high?
Well, what number is high for cholesterol? For children, 200 is a high number. 170 is a normal number, 170 or below for the total cholesterol. If we talk about the LDL, the low-density lipoprotein cholesterol, a number of less than 130 is a good number.
So in other words, the number game is important even in a young age group.
Even in young children, in order to prevent them from getting sick when they get older. Not that they're going to get a heart attack or a stroke when they're a child, but in order to keep them healthy, because we know the plaques that form in our arteries that result in heart attacks and strokes start soon after birth, accelerate during adolescence, and then develop over the decades of our adult life. So if we can prevent them from ever starting, children will live longer and healthier.
So in other words, if you have a high cholesterol and the kid, say, is 3 or 4 years old, how would you approach the problem so we can lower the cholesterol a little bit? Obviously the bad cholesterol in particular.
That's right. The important thing to do for a child of that age is to assess their diet, to find out what they like to eat, what they usually eat, and see if we can help them and their family learn to make healthier choices. So we focus on what they're currently eating and use a trained nutritionist, a registered dietitian, to assess that and then to help the family eat better. And it works better if the whole family does it, not if one person is singled out as the culprit, so to speak.
In other words, if it's in the kitchen, the kid might grab it.
That's right.
Impulsively.
It's going to be if it's in the it's not going to happen that the whole family is going to sit around eating meatball heroes and the child is going to eat a salad. People have to, families eat as a family, and that's important because cholesterol it's shared in the family as well.
And we also have a problem with kids aren't exercising as much. And exercise would help lower the bad cholesterol a little bit.
Exercise is important. It helps keep the balance of lipids like triglycerides, which we haven't mentioned. That's another kind of fat in the blood. So exercise is important for lowering triglycerides, which helps raise the good cholesterol and gets everything in better balance. And you're right, kids don't have the same opportunity to exercise that they had years ago. They don't just run out in their neighborhood and play very often. They're much more restricted.
So if you had a kid and the father had a heart attack at 28 or something like that, it was a big concern. The first cholesterol you would check in the kid would be recommended at what age?
Age 2.
Age 2. If it was normal at age 2, when would you repeat it again?
Repeat it again during school age between 5 and 10 and once during adolescence. But the chance that it's going to develop into a serious problem if it's normal at 2 is very low.
So it's a good sign if your cholesterol, say, is 160, 170, yes. And not such a good sign if it's over 200.
Yes.
So at that point, you would try to get the family to change the eating habits or control them a little bit.
That's
and
right.
Encourage more activity.
Absolutely.
Is there any play of any of these medicines you see all over TV and the Today Show and all this? Are these medicines recommended for children?
They're recommended for adolescents.
So not young kids.
Kids over age 10 who have a family history, like you mentioned, a father who might have had a heart attack in his 20s or 30s, or a mother, and who have an LDL cholesterol that's above 190. So these are very high cholesterols, 300 cholesterol.
If you do get a kid that has a cholesterol, say, you mentioned 300, and the kid's 2 years old, and they try to exercise, and they're trying their best to keep a good diet, is there anything else we could do for these kids?
There are some dietary supplements that you can use, things like plant sterols and stanols, which are available both as margarine or as shakes, or which can be given in a pill form. Fiber is important. Fish oil can be helpful, not so much for cholesterol, but for triglycerides.
The omega-3 supplements are good?
The omega-3 supplements help the triglycerides, and we do use those in children.
We mentioned before about this plaque. Doesn't that cause little ridges and unevenness? It's not smooth. What happens to the cells that go past the red blood cells? What can happen to them?
Well, that plaque can slow them down, make them form clots, and those clots can block the arteries, and the arteries, as you know, are very needed to bring oxygen and nutrition to the cells. And so if they block, if an artery in your heart gets blocked, well, then you have a heart attack. If an artery in your head gets blocked, then you have a stroke.
So if we lower the bad cholesterol and we raise the good cholesterol, what happens to plaques?
The plaques disappear. They smooth over, and they can be gone over a number of months to years. So it really is very important that we lower that LDL cholesterol.
So the plaques sort of smooth out the good cholesterol, and that bad son of a guns make it worse. Is that correct?
That's right.
So down the road, there's even talk that maybe they might even inject that good cholesterol in some people. Is that true?
There are some studies where they're trying to do that, inject the good cholesterol if you really have a problem. That's not going to be a treatment for children. That would be for adults that already have heart disease or strokes.
So in other words, our focus is increase the good, decrease the bad cholesterol. So high density is good, low density is bad. You mentioned already exercise is good.
Yeah.
And you said you changed the eating habits.
And eating right, that's right. And I want to say that the most important thing really is lowering the bad cholesterol. The good cholesterol is we kind of get what we're going to get. There's very few things that we can do to change the good cholesterol, but we have a lot of things we can do to change the bad.
Will raise it a little bit,
Exercise may help a little bit. If you have the kind of lipid problem where your triglycerides are very high, lowering the triglycerides will raise your good cholesterol.